Have you ever thought that medicines you take to relieve pain, control blood pressure, or fight infection might actually be harming your kidneys? Yes, it's true. While medicines help manage health conditions, some of them can put a heavy load on your kidneys, the organs that filter out toxins, waste, and drugs from your blood. In today's video, I will share 7 common medications that can damage your kidneys, especially when taken for long periods or without medical supervision. Hello everyone, I am Dr. Madhvi Vash from Bharat Homeopathy. I have extensive clinical experience and expertise in treating kidney disease like chronic kidney disease, nephrotic syndrome, polycystic kidney disease and glomerulonephritis. So if you or your loved one is struggling with any kidney disease or you are proactive towards better kidney health, make sure you watch till the end because this information can literally save your kidneys and your life. Now let's get into the list of 7 common medications that can harm your kidneys. We all use painkillers, right? For headaches, muscle pain, joint stiffness, or menstrual cramps. But did you know that painkillers like ibuprofen, Advil, Brufen, naproxen, and diclofenac are among the top causes of kidney damage worldwide? These drugs work by blocking certain enzymes called COX1 and COX2, which help produce prostaglandins, chemicals that maintain blood flow to your kidneys. When prostaglandin production is reduced, blood flow to the kidneys drops, and this can lead to acute kidney injury, especially if you are dehydrated or have any other health issues. If you rely heavily on painkillers for chronic conditions like arthritis, try to use natural anti-inflammatory herbs like turmeric or ginger. Now, the second kidney harming medicines are antibiotics. Antibiotics are lifesavers, no doubt, but some classes, especially aminoglycosides like gentamicin, tobramycin, and amikacin and vancomycin can be toxic to the kidneys. These antibiotics are often used to treat serious infections like sepsis or pneumonia. They accumulate in kidney tissues and damage the nephrons. This is why doctors monitor creatinine level closely when patients are on these medications. Even commonly used antibiotics like ciprofloxacin and sulfamethoxazole trimethoprim can cause kidney inflammation or crystal formation, blocking urine flow. So it's crucial to never self-medicate antibiotics and to stay hydrated when taking them. If you suffer from acid reflux or gastritis, you might be taking proton pump inhibitors like omeprazole, pantoprazole or esomeprazole. While these medications relieve acid-related symptoms, long-term use can be linked to chronic kidney disease and acute interstitial nephritis, a condition where kidney tubules become inflamed. If you rely on antacids daily, talk to your doctor about tapering the dose, or you should look for other natural alternatives or make some dietary changes. Now, the fourth category of drugs that harm kidneys are diuretics. Diuretics like furosemide, hydrochlorothiazide or spironolactone are often prescribed for high blood pressure, heart failure and fluid retention. They help the body eliminate excess salt and water through urine. But when overused or taken without medical monitoring, diuretics can dehydrate the body and cause electrolyte imbalances, leading to reduced kidney function. People with kidney disease should be carefully monitored when on diuretics, as too much fluid loss can worsen kidney injury instead of helping it. Now, this category of medicines might surprise you. Some medicines that protect your kidneys in long run can actually cause temporary kidney damage if used incorrectly. I am talking about angiotensin converting enzyme inhibitor or ACE inhibitor like enalapril, lisinopril, ramipril, and angiotensin 2 receptor blockers or ARBs like losartan, telmisartan, valsartan. These medications are excellent for people with hypertension, heart disease or diabetes as they help prevent kidney scarring. However, they work by dilating blood vessels in the kidneys, which can temporarily reduce filtration, especially if your blood volume is already low due to dehydration or diuretics. Remember, ACE inhibitors and ARBs are safe when used correctly under medical guidance. The key is monitoring. Now, let's come to the cancer medicines. Well, I am talking about chemotherapy drugs used to treat cancers such as cisplatin, carboplatin, and methotrexate can cause direct kidney toxicity. These drugs are powerful but damage the cells in your kidney tubules, especially when hydration is poor during treatment. Doctors often administer intravenous fluid before and after chemotherapy to protect the kidneys and reduce the buildup of toxic metabolites. In many cases, doctors may adjust doses or switch to less nephrotoxic alternatives depending on your kidney health. Now, the last category of medicines might shock you, but it's true. Herbal supplements and over-the-counter medicines can also damage your kidneys. Many people assume that herbal products are harmless, but some supplements, especially those containing aristolochic acid, which is found in certain weight loss or detox herbs, can cause severe kidney scarring known as aristolochic acid nephropathy. Even high doses of vitamin C or creatine supplements can overburden the kidneys, especially if you already have reduced kidney function. Alright, so these are the 7 categories of drugs you must know if you are a kidney patient. I hope you found this video helpful. Please share and subscribe to the Bharat Homeo Kidney Treatment USA YouTube channel so that you can get many latest videos on kidney health. Thank you so much.